We had 6,774 COVID cases yesterday. There were, I think, 16 additional deaths over the December 4th through January, maybe it was December 14th through January 6th date. So it's holding pretty steady. And I just want to ask you, as far as a pediatrician and also as president of the State Medical Association, your overview of where we are today in the 1st of January with this pandemic.
Do you mind if I take a moment to overview the last 2 years? Or
Sure, absolutely. Let's do that too.
I just feel like we spend so much time in the minute, in the moment, and with the numbers and that sort of thing that, I've been in this for 2 years. I'm not the only one. There's lots of people who've been busy with this. I'm a practicing general pediatrician, so I've kind of been at the front of it all along. And I can promise you, yes, there's lots and lots of Omicron because I've been getting a lot of positive tests. But if we think about, COVID-19, first off, it's named COVID-19 because it was first discovered, named in the tail end of 2019. Here in America and Mississippi, we watched it go around the world. We thought, well, maybe if we did some things, we can stop it from coming here. But it's a respiratory virus, and they find their way on planes, and it's just not that hard to get here. Mississippi started having problems in April of 2020. And for me as a pediatrician, it wasn't as much of a problem because the first variants did not really affect children that much. But it was devastating for me to watch what was happening to our elderly population, to our senior citizens, especially people 75 and older in nursing homes. It was devastating. And the biggest problem was, as medical people, I just take a moment to say that coronavirus was called a novel virus. You never want medical people to talk about something novel. It sounds great, but it really means it's new and we don't know what to do with it. And that's where we were. We had none of our antivirals worked. All we had was supportive care, which, of course, my adult doctors, friends did great, but you were dealing with something that just was a tremendous insult to these folks, especially older folks, and there just wasn't a lot to do. That was the first wave was in April 2020. We had a wave in July 2020. And again, we had nothing but supportive care for those. We tried different things, but really nothing that worked that well. The third wave was in December of 2020. And that's when I started getting a little optimistic because, we had that big push to get a vaccine very quickly, which, of course, we can talk about because of the pros and cons of doing it quickly. But I was one of the first people in Mississippi to take that vaccine in December 2020. I was happy to do it. I've had my booster, that sort of thing. But what you saw, what I thought was absolutely fantastic was what happened after that third big wave in December and January where people were getting vaccinated, and the numbers went down tremendously. It was almost exciting. I got kind of optimistic that perhaps we would even get out of this thing the way people thought we would, but it was a bit optimistic because we didn't have, the people that felt the most vulnerable, which senior citizens, people with underlying health issues, even my teenagers and all that were qualified that could have taken the vaccine and had underlying health issues took it. And so we did have a big drop in the deaths in people older. And the vaccine, again, started then. And then we were rocking along doing good. Like I said, I felt a little optimistic. And all of a sudden we had July, August of 2021, and Delta came along. And as I mentioned before, Paul, before Delta, the variants really didn't affect children that much, but that was just devastating. We started seeing infections in children. What was even worse is we saw bad infections in pregnant moms. This was completely depressing. I had two moms whose babies were delivered by a C-section while they were on the ventilator. One of the moms got off the ventilator, the other did not. The Delta wave was a wave of the unvaccinated, mostly young people. And this is where it's kind of hit me, too, as a pediatrician, because these are my parents. These people bring their children to me, and now some of them aren't there. So we had the Delta wave, and again, Some other people felt they could get vaccinated. We had the great news, of course, back in the summer, the end of the summer, children from 12 to 15 could be vaccinated. And then just recently in October, it included 5 to 11. And that's great. But then we have Omicron come along, which the good news there is it is more contagious, which is not the good news, but it's less infectious. It seems to give you a milder disease. But it's still a bigger problem for the people who are unvaccinated. Yes, you've got people who are going to say, well, I'm fully vaccinated, and all these fully vaccinated people got it anyway, but they're having milder disease. They're not going in the hospital. They're not being in the ICU. They're not being put on a ventilator. And I think that's great. So here we are in January 2022, 2 years later. I'm slightly optimistic, but I'm here because I'm optimistic because we have a vaccine that is doing what we want it to do, which is keep you out of the hospital, keep you out of the ICU, and give you a mild disease. It does not completely prevent it. I mean, I like to say most vaccines, especially respiratory vaccines, are more of a shield than a force field.
I think anybody can appreciate, Dr. Weiland, when you're starting off with a novel virus, you have no information at all. You don't know where to go. And the information you need before you can put that in a laboratory to start research is data. And I was optimistic early on in 2020, and I said this on the air, at no other time in history do we have these computers, these supercomputers that just blow the mind at the amount of things that they can do in 1/10 of a second that it would take us forever just 5 or 6 years ago. And I thought, okay, well, the compilation of all this data, and I think it did help to speed up the vaccine. But there were a lot of things we just did not know, and we still question today is why are we getting the breakthrough cases from like Delta? Why did we get some of the breakthrough cases? And even though we are getting the breakthrough cases, we know, just like flu, if you do get the flu, it'll be mitigated with a flu shot. We understand that. But does that say something about, do we need more data on how long the immunity lasts from the first 2 shots, if it's Pfizer or Moderna, along with the booster?
Oh, we always need more information. I mean, again, just because it's novel, we have to continue to get the data. And the other thing is this, and I'm not trying to place any blame here, but the fact that there wasn't a big push, especially in Mississippi, there was a push, but there wasn't a lot of receiving. There were a lot of people who didn't feel they needed to take the vaccine. And what we have to understand, again, not trying to place blame, but what we try to understand is those people are little incubators for this virus. And viruses want to mutate. They want to change. They want to make it where they get past whatever your defenses are, and that did happen with Delta. It was unfortunate that it was the double whammy. It was more contagious and more deadly than the original variant. But again,
go ahead.
But again, it was mostly a disease of the unvaccinated. Yes, people who are vaccinated could get it, but the people who had the biggest problem were people who weren't.
Well, you go back and you look and you say, all right, if we had a chance to do this over, how would we do it? Could we have used herd immunity with those who are less in dangerous situation? If it's a healthy young adult or healthy child, then forget about the vaccine. Let them go on and get it. And then let's just make sure that everybody with in that category that had underlying issues or of that age, then you need to quarantine, you need to get the vaccine, and then we'll march on from there. So it was very hard, especially when you put all the politics together with it. I want to talk more about this with Dr. Geri Weiland, who is also a pediatrician and president of Mississippi State Medical Association, when we return, coming up next. Can you kind of assuage the fears of some of the parents out there by getting their 5-year-old a vaccine?
Yes, I actually have this conversation kind of on a daily basis. Yesterday, grandmom brought the child in for, I can't remember what, but then she said, well, what do you think about, and this child was like 7 or 8, what do you think about the vaccine? Now, of course, she was the grandmom, and she was going to talk to mom, and I said, well, I believe in vaccines. I could sit here, we could do a whole other segment on on the great things that vaccines have done over the years. Some people have never heard of Haemophilus influenza infection. It was a horrendous bacterial infection when I was a resident in early practice. It was eliminated in Mississippi by vaccines. We don't see it. We just don't see it. So everybody, and your comment before the break was interesting. Why don't we all just go get it, sort of like the old chickenpox parties and measles parties and things like that? Well, we have to remember that it is not just a common cold. There are people that are going to die from this, and you can't even just say it's people with underlying health issues, although they're more at risk. The things we have to think about, though, Paul, are we know that things even like mononucleosis is caused by EB viral virus, and it increases your risk for diabetes. We know that chickenpox is innocuous. That was. I mean, everybody in my generation either had it or they had it, and then there was the chickenpox parties. But, chickenpox leads to shingles. And there's a really good chance, this is fantastic, there's a really good chance that these children who are in their 20s will never even have to worry about shingles because they took a chickenpox vaccine. So they may not even have to take the shingles vaccine. So,
if you know anything about shingles, and I've related this on the air, Doctor, many times when people are really reticent about going getting the vaccine, which I've had both and the booster. I said, and you don't know what's in a shingles shot. You have no idea, but you know the effects of shingles, and it's something visual that you can see, and you don't want it. When you realize there is a vaccine out there that will keep you safe from shingles, it's not an absolute guarantee. I'm sure there are some possibilities that you could get it. I think it's 90% or something. But you go get the shot. You don't ask questions. There's no big political movement on that.
Oh, I know. A good friend of mine just recently had shingles of the face and the eye, and you can actually lose your vision. I had not gotten my shingles shot, but after that I went and got it, and my husband got his, and I've been a big proponent. I just hadn't done it because I had done so many other things in the last 2 years have been difficult. But my point is, we don't know what COVID is going to do if you get it. We don't know that 10 to 20 years from now it doesn't lead to other underlying health issues. We don't know it doesn't lead to diabetes. We've already seen an increase in diabetes in children who have had COVID. We don't know what other long-term effects there are going to be. And the vaccine is safe. It was pushed through fast, but I like to joke, since my husband worked for the government, that, the government isn't known for doing things fast. But in this case, somebody put a fire under them, and they did. And they didn't cut any corners. They just didn't sit there and go, well, I'll get you that in 2 weeks, because the people above them were saying, no, you can get me that back today. And the studies were still done, and everything was done safely. So I do recommend it. I recommend it as just like any other vaccine. It's safe. It's not. I mean, there's no completely safe medicine or vaccine. I like to also joke to my patients and parents, if aspirin were to come out today as a new medicine, I'm not sure it would get approved. It's got so many side effects. I mean, it does a lot of great things, but it also has a lot of problems. So all you got to do is just listen to the disclaimers on any medicine out there and scare the hell out of you. That was what my husband does. It's like, what does this treat, and why would I take it? It's
just diarrhea for about 30 minutes. Okay.
Yeah, well, the greatest one I've ever seen is the one that was a medicine for people who had short eyelashes. And I have no idea what this medicine is, why it was needed, but it would help your eyelashes grow. And I'm sitting there fixated on the TV thinking, why would anyone take a medicine? Then they have the long disclaimer of everything from, Perez, the aforementioned diarrhea, to everything else. And I'm thinking, you would take this medicine for longer eyelashes? But it is.
But you don't want your COVID vaccine. Okay, I have a problem with that.
Have you seen anything as far as in pediatrician in your practice, as far as kids who don't seem to have any underlying issues, heart palpitations or swelling or anything like that?
With the vaccine?
Yes, ma'am.
I've not seen. I've had 2 cases of in my older, between 12 and 18, that had some chest discomfort. 2 out of all the shots that we've given. I checked them out; they were fine. But I really haven't seen any real big problems with that.
From what
I do want to say, I'm sorry, you mentioned why would we not want to go ahead and just let everybody get sick? In addition to the fact that there will be people that die and have problems, there is that not new, but is the MISC, which is the multi-system inflammatory syndrome of children that is associated with COVID, and it's actually a post-inflammatory thing. In other words, you might even have COVID so mild that you don't know it, and then 4 to 8 weeks later, these children get tremendously sick. I was talking to some folks at the Children's Hospital, texting. The young folks don't talk; they just text to you. But that in December, mid-December, right before Omicron became a problem, there were no COVID admissions at Children's of Mississippi. The end of December, there were 12 to 13. Last week, there were 12 to 13. I talked to Dr. Jenny Hong, and she gave me information that they're keeping a census of 15 to 20 children on a daily basis with COVID, and an average of 2 to 3 in the ICU on a ventilator. So it's not, and some of these are MISC. I've had one case in a young 6-year-old, and he didn't even have COVID that was diagnosed, but he came in with this high fever he had a fever for a week, and some of the other symptoms. It's a Kawasaki's-like disease, which your viewers may not be that familiar with. It's very rare, but it's more common with the COVID. And it can be treated, but you don't know what the long-term ramifications of that are.
Dr. Robert Malone is a virologist, immunologist, inventor of the mRNA vaccine. He was on a program and he explained something that's going through China now. It's apparently sweeping through China. I'm not sure if this is accurate or not, and I hate to even bring it up. But Dr. Malone explained this disease moving across China has been described as an Ebola-like hemorrhage or hemorrhagic fever virus. Seems to present itself differently than COVID due to the extremely limited information being released from China at this time. There's little known about this new disease. Have you heard anything about that?
I'm sorry. You've educated me on that. What we can hope, if it's Ebola-like, what we can hope is that it's like Ebola and it's blood transmission and not respiratory. Let's hope it's not respiratory.
Well, we hear about these things, and you can have one case somewhere over in Israel, and everybody blows it out of proportion. And I think some things like this go on all the time. But as far as our kids in the state of Mississippi, can you give an idea how many people do you think we have now have the vaccine as far as the children?
Oh, the children numbers are not very good. I didn't get those from Dr. Byers. We're still trying to encourage people to do it. Again, a lot of parents are reticent about the vaccine. It's new. I understand that. I've been talking to parents about new vaccines for 40 years. There's been several new ones that come out. I hope that they see the benefit in the long run to do this and get their children vaccinated. I have had a really good response in my clinic from children who have underlying health issues, and there is a little bit of a push, since if you've been vaccinated, you have a different quarantine, and if you've been vaccinated in the public school system, and your teacher has COVID or one of the people sitting next to you have COVID, you don't have to quarantine. Yeah. Now, the people who aren't vaccinated do. So it does make a difference in that respect.
We got a news release yesterday from CDC Director Rochelle Walensky, and she said the agency will release the distinction between those who died from COVID and those who died with COVID. It was an interview Sunday. She was pressed on how many of the more than 800,000 deaths linked to COVID died from the virus or other comorbidities, and she will have that number for us because they're trying to dissect that a little bit. Always informative. Don't be a stranger. Love to have you back on.